Aloha, Kauai. I'm Mike DeHelig, Managing Director, and this is your weekly County of Kauai briefing for Monday, November 1st. Hope you all had a safe and fun Halloween weekend. The federal government is nearing approval of the first vaccine for children ages 5 to 11. The FDA approved the Pfizer vaccine for this age group last week, and the CDC is meeting this week to discuss clinical recommendations. We expect the first vaccines for these kids to be available on Kauai next week. Talk to your doctor now if you have questions. Our vaccination distribution points here on Kauai will be able to handle this at our clinics, hospitals, and pharmacies. These folks are working to offer vaccine clinics at days and times that are convenient for working parents with school-aged children. Information will be updated as we get details. Our keiki have missed so much during this pandemic: team sports, birthday celebrations, get-togethers, and family trips. The vaccines are key to keeping these activities safe for our keiki. Our daily case count on island remains elevated. We currently have the highest case rate per capita in the state and the highest test positivity rate in the state. Thankfully, our case count is stable at this time. For the latest on our daily case count and clusters, we turn to Kauai Deputy District Health Officer Lauren Guest. Lauren?
Thanks, Mike. Over the past week, our average daily case count was 12 cases per day. We currently have 3 active clusters on island, 2 are the results of social gatherings, and 1 is in a construction industrial setting. Today, the Kauai District Health Office is reporting 12 new cases in residents, including 3 children and 9 adults. If you're sick, stay home, don't go to work or school, and get tested. 1 infected person can start a cluster. Free tests are available without a doctor's order or insurance at the Convention Hall, Lihue Pharmacy, and from our mobile van. The Convention Hall Testing Center is open weekdays from 8 to 3:30. Our mobile testing van is open in Keikaha on Wednesdays, Kilauea on Thursdays, Kalaheo on Fridays, Hanalei on Saturdays, and Kapa'a on Sundays from 9 to 1 each day. Lihue Pharmacy is open 7 days a week from 9 to 5. Sign up at preventcovidhawaii.com. Tests are also available with a doctor's order at Wilcox, KVMH, and clinical labs. For a full list of testing locations, visit kauai.gov/COVID-test. If you test positive, isolate yourself at home and let your close contacts know they've been exposed and should quarantine. Mahalo everyone for doing your part to keep this community safe.
Mahalo, Lauren. If you travel off island, please get a free test 3 to 5 days after you return to protect yourself, your ohana, and your colleagues or classmates. President Biden announced that many foreign national travelers who are fully vaccinated will be allowed to travel to the United States beginning next Monday, November 8th. We expect Governor Ige to announce updated rules later this week for international travelers who want to travel to Hawaii. Now, it's time to answer some of your questions for Kauai District Health Officer Dr. Janet Behrman with Ask Dr. B. Dr. B, we're still getting a lot of questions about boosters. Who exactly is eligible for a booster now? If you're eligible, do you need to get one to travel or attend events?
Thanks, Mike. No, you don't need a booster to be considered fully vaccinated to travel or to go to events. If you completed your initial doses more than 2 weeks ago, you are fully vaccinated. The question of who's eligible is a bit more complicated. The easy part: everyone who received the Johnson & Johnson vaccine is eligible for a booster 2 months or more after their initial dose. If you receive Pfizer or Moderna vaccine and you're 65 years old or older, you are eligible for a booster 6 months or more after your second dose. If you got Pfizer or Moderna and you're between 18 and 64, it's a little more complicated. You're only eligible if you have underlying medical conditions, or live in a long-term care setting, or work or live in high-risk settings. If you're under 65, received Pfizer or Moderna, and do not meet any of those criteria, you do not need a booster, and you're not eligible for one. A booster is not recommended or approved for you because your initial vaccination series provides you with great protection. You do not need an additional dose. Keiki age 12 to 17 are also not eligible for boosters.
Thanks, Dr. B. So what does it mean for eligible people to mix and match the booster dose? How should people choose which one to get?
If you're eligible for a booster dose, the FDA and CDC have approved any of the 3 available vaccines. Your booster vaccine doesn't need to match your original vaccine. It's your choice. The good news is that whatever product you choose, your immunity will be boosted. Some of the things you might want to consider in making your choice are what's the most convenient for you? Are there differences in side effects that are of particular concern to you? Or did your initial vaccine go well for you and you want to stay with your choice? You may want to talk to your own healthcare provider about your specific situation or concerns. If you're eligible for a booster or want to schedule your initial doses, a full list of clinics, hospitals, and pharmacies offering the vaccines is posted at kauai.gov/vaccine.
Finally, what about kids younger than 12? Should parents vaccinate their kids even if their children are at a lower risk of severe disease?
Vaccines reduce your keki's chances of getting sick if they're exposed. They also reduce the chances that your keiki and your family will have to isolate or quarantine. Although COVID-19 in children is usually milder than in adults, some children become very sick, requiring hospitalization, and some experience long-term health effects. In Hawaii, 2% of the children who get COVID have required hospitalization. That's 2% too many. Children who are infected can transmit the coronavirus to others even if they have no symptoms. The COVID-19 vaccination protects the child and reduces the chance that they'll transmit the virus to family members, friends, and others. In August of 2021 alone, statewide there were approximately 4,500 pediatric COVID-19 cases, more than in the previous 7 months combined. We're excited about the approval for 5 to 11-year-olds because this is another key step toward keeping our keiki safe and returning our community to normal.
Thanks, Dr. B. Remember, if you have questions for Dr. B, please post them on our County of Kauai Facebook page. We'll also provide updates on how to sign up for keiki vaccinations in the next week's video update. If you need your first doses, come to one of our free mobile clinics this week. The team from Ho'olahui will be out this Saturday morning, November 6th, at Kanu'ikapono Public Charter School and at Kaumakani Community Hall, open from 9 to 11 a.m. in both locations. The Wilcox Hawaii Health Systems mobile van will be open at the Kapa'a Neighborhood Center this Thursday, November 4th, at Kaloa Neighborhood Center on Friday, November 5th, and the Hanalei Neighborhood Center on Saturday, November 6th. It's open from noon to 3 p.m. at each location. These mobile clinics offer all 3 vaccines to everyone 12 and older. No appointments are necessary. They are completely free. For the full list of locations where you can get a vaccine 7 days a week, visit kauai.gov/vaccine. Mahalo to everyone working together to keep our community safe. Please, if you travel, get tested. If you gather, stay outdoors. Wear a mask when around others. Stay home when sick. Get vaccinated if you can. Mahalo, Kauai.